Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
Well, it is the season of politics to some degree, with Governors McCrory and Haley presenting their State of the State, and both North and South Carolina General Assemblies are now in the process of making, modifying, and sanctioning laws and public policy. Better said, priorities are being established for 2015 and beyond. Welcome again to the most widely watched program on business and public policy. So what are the most important issues to get right? And what's the difference between what elected officials see as critical and the electorate that think are important? Healthcare, roads, and education, to be sure. We'll begin this week's dialogue, and later, joining the discussion is Novant Chief Carl Armato.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. On this edition of Carolina Business Review, Jeff Michael, Director of the UNC Charlotte Urban Institute, Dick Wilkerson, Retired Chairman and President of Michelin North America, and special guest Carl Armato, President and CEO of Novant Health. And now, here's Chris William.
Welcome to our program. Jeff, good to have you back. Dick, welcome.
Good to be back. Thank
By
you.
the way, Dick, we've been trying to get you since the early 2000s. I'm glad we finally got you to sit down. Thank you for your time.
No, I'm glad to be here.
Not to put you on the spot, but thank you for being here. All right. So, gentlemen, there, by any estimate, in North and South Carolina are losing millions of dollars a day in taking federal Medicaid dollars. Both governors, Nikki Haley and Pat McCrory, have come out against it. McCrory is warming up to it to some degree. But Dick, you know, you spend some time now on the Greenville Health Board, as well as other health care issues. Do we just need to take this and fix Medicaid, or is there something we're not thinking about Medicaid that makes sense for why we're not taking it?
Personally, I believe the right decision would be to take Medicaid. Now, I know Governor Haley and Tony Keck, who I really respect, came out with a financial evaluation that showed long-term there was a significant cost to the state. But I believe that the benefit is significant in taking it. Part of the reason is systems like the Greenville Health System are really getting punished by this, because part of the deal was Medicaid would go up, and in return for that, the reimbursement for Medicare would go down. So when we decided not to take Medicaid, we still got the reduced Medicare rate. And so health systems like Greenville Health System are suffering because of this. It puts you're paying the tax no matter what, because other people are going to fund through the healthcare system prices the shortfall that comes from having Medicare reduced while Medicaid did not go up as planned.
You know, Jeff, you hear Dick talk about critical mass like Greenville Health in the upstate South Carolina. We're going to have Novant's chief on in a second to talk about that. But when you compare rural and urban, and you overlay that there's already a fairly large gap, even given what this recovery's done, for those folks seeking health care in the rural parts of North and South Carolina, does the lack of Medicaid funding from the federal government to both of these states right now, does that put additional stress on providing health care? And what will happen, you think? And is there a tipping point at some point where rural really does go off the cliff?
Yeah, in fact, I think it was a year ago, there was a mayor from Eastern North Carolina who was traveling up to Washington, D.C. because of the impact that that decision was having on their local hospital. And, it's anecdotal from my perspective, working here in Charlotte, but what we hear is that that decision really is having an impact and placing stresses on the hospitals in these small towns, rural communities. And when you look at these communities and understand that there aren't a lot of options for them, even economically, it's an economic development issue as well.
Which is a good point, and thank you for that nice segue, because we're going to go to another legislative priority. And we're staying on the legislative priority idea because both sessions, both the State House in Columbia and General Assembly in Raleigh are back in session. The governors have come out with their state of the state, and they're all optimistic about many things. Transportation seems to bubble up now as being a very hot issue, even above education to some degree. Dick, again, you've been around the Palmetto State for a while. Roads are always an issue. Speaker Lucas has said that transportation is going to get a look. How serious do you think that lawmakers in South Carolina are going to get behind this funding of transportation?
I'm not sure. My comment would be perhaps not seriously enough. My successor at Michelin, Pete Selleck, courageously stepped out and said that the road situation in South Carolina is an embarrassment to our state. And he's right, and I agree with him. And something has to be done. I'm concerned that some of the proposals look kind of fishy to me. For example, raising the gasoline tax while reducing the income tax and saying that it's revenue neutral.
And this is what Nikki Haley came out with in the
Right.
State of the State. Yeah.
And I haven't looked at it closely enough, but my question to her would be, if it's revenue neutral, it means we have the same amount of money now as we will in the future, so why can't we fix the roads now? You see, if you're going to have the same amount of revenue coming in by increasing the gasoline tax and reducing income tax, then where are you going to get the money in the future that you don't have now?
So what's the answer to that?
The answer to that to me is increase the gasoline tax. Why? Because 30% of the revenue from that comes from people outside the state. It allows us to harvest money from people coming through who are using our roads and pay for the road improvements that we need.
Is there a toll road equation here that makes sense for South Carolina?
I'm not an expert in that. To me, it's much more straightforward to go ahead and have the gasoline tax increased or make it a percentage of the gasoline price so you don't have to face this all the time. If you look historically, what's happened is cars have become much more efficient. The amount of roads has dramatically increased in South Carolina. So the actual revenues are not nearly effectively for inflation what they used to be, although we have many more roads to maintain. And so what we've done is reduce revenues devoted to roads while we've increased the number of roads we need to maintain. This is an equation that doesn't work.
It's not going in the right direction. Yeah. It's not unique to South Carolina, Jeff. Governor McCrory's laid out a new transportation funding formula.
Yeah.
But the question still exists, where do we get additional revenues for a state that has some serious roads and bridges and transportation issues?
Yeah, and I think this week, I will not pretend to understand it, there was a new proposal, I think, rolled out in the legislature to somehow, I'm not sure if I understand if it's decreasing the gasoline tax or increasing it long term. It seems like there's some debate going on what it actually means long term. But then, of course, we are looking at tolls here in North Carolina as a solution. In the Triangle, you have the Triangle, I think it's Expressway, and then here in Charlotte on Interstate 77, we have an HOV lane that's has been proposed to be paid for with tolls, and it's become quite controversial. So, that's one of the dilemmas I think policymakers and transportation planners face. Where do you find that revenue in a way that's palatable to the public?
So if you could, either one of you gentlemen, if you could take the politics, and I don't even know how to begin to do that, but if you could take the politics out of this debate, is there a way to do it? Dick, is there a way to do it? Is somebody doing it right somewhere in this country to get the revenue for roads?
I don't know. I think taking the politics out makes sense because it's a very simple problem. You have this many roads to maintain. This is what it costs. You have to have the revenue to do that. If you tell people 20 years ago you bought less fuel in gallons than you do now, and the tax is on a cents per gallon basis, you're actually paying less gasoline tax now than you did 20 years ago to maintain more roads. We can't do that. Now, you can tell people we're not going to increase taxes, we're not going to do this, we're not going to do that. That will not solve the problem. We need to be honest with people. It's going to impact our ability to draw jobs here and industry here if we continue to let the infrastructure decay.
Yeah,
it's that simple.
That's going to have to be the last word. More talk about that. Gentlemen, stay with us. Bring our guest on in just a second. Next week on this program, he is the Executive Vice President of one of the largest insurers in the country and the world. His name is Eric Steigerwalt, and he is, as I said, EVP of MetLife. Why is that important? Well, a lot of reasons, but MetLife announced last year that they were moving to Charlotte and Raleigh, moving 2,600 jobs. It was one of the single largest corporate reloads in the Carolinas history. We will entertain and talk to Eric next week on this program. Domtar, another international paper company that has been quietly working in the Carolinas for a long time. John Williams, Chairman and CEO of Domtar, will be on this program next week. You know, there were seriously meaningful changes this year in the Affordable Care Act's enrollment, deployment, and no doubt the law's broader halo effect on healthcare providers. Questions are, how are the hospitals managing the immediate changes as well as the road ahead? Joining us now is Winston-Salem-based Novant Health President and Chief Executive Officer Carl Armato. Carl, welcome to the program.
Glad to be here. Thank you.
Wow, what a job! You've got a new wrinkle in the Affordable Care Act. The Obama administration has come out saying we really want to get serious about how we incentivize docs. How does that fit into the way you're strategizing, where you're going with Novant, and especially with this flag in the ground that President Obama said, we're serious about changing the way incentives are?
Right. I'll start with what we've done at Novant Health is we actually proactively began to transform healthcare long before the Affordable Care Act. And what I'm proud to tell you is now that the act is here, it just has re-energized our organization again, about making healthcare affordable, easy to access, and really convenient for the people we serve. Part of what we're doing to align incentives, though, with our physicians and our providers is we've actually created these patient-oriented delivery systems, which we call pods, across our markets. So the 4 states that we operate in, where we've got 150 to 200 doctors overseeing the care for roughly 50 to 200,000 lives. Then we took the hospital-centric assets. So the hospitals themselves, the freestanding emergency centers, the ambulatory surgery centers, all of our clinics, the once hospital-centric resources of discharge planning, think about social workers, pharmacists, all of that into these pods that are now truly proactively trying to care for patients in a new and unique way, and really getting at the business of health versus waiting for people to be sick. And so the beginning of starting to transition the payment model for us is on our own employees. So we have 37,000 team members and dependents that are part of these pods that our physicians are now truly trying to improve the health of this population, our team members, and we're going to incentivize them through the cost savings that they're generating. So here again is the beginning of us beginning to show that we've got to move from the fee-for-service model to start paying for high quality and outcomes in keeping people healthy.
So do the changes in 2015's Affordable Care Act, does that make it easier? Does that supercharge something you're doing around your pods, or is it non-meaningful?
Well, I tell you right now, the Affordable Care Act, it's early in its implementation, and I would tell you it's probably a little neutral to slightly positive to really the impact when you look at the financial impact of where we are. Now, I think Dick is absolutely right with regard to hospitals, including Novant Health. You gave up a lot in the way of Medicare reimbursement on a promise that Medicaid expansion was going to be there. And I'll tell you, when I look at whether it's our emergency rooms or some of the locations in our hospitals, and I see Medicaid patients who, for example, have absolutely, their income level is too high for Medicaid, but too low to cover the, private insurance, we're still seeing these people access health care in the most unaffordable place in health care. And that's what we've got to interrupt, because that's unsustainable. So really, Chris, I'm seeing a lot of good momentum. I would tell you the Affordable Care Act, what it's done for us at Novant Health, it's actually just energized us and the culture around transforming healthcare to truly be a leader in transformation and not waiting for someone to give us the answer.
Yeah, okay. Dick, question?
Yeah, a kind of a global one to put you on the spot, Carl. The most recent data from the Commonwealth Fund study of 11 developed countries once again showed the United States as the most expensive per capita by about 50 to 60% over who's in second place, yet 11th out of 11 in healthcare results. If I'm a CEO and I have the most expensive product by 60% and the worst results, I'm not going to be a CEO long. We don't have a CEO of healthcare in the United States, but if you were that person, how would you get us competitive? Because from a company standpoint,
right,
like Michelin, it's a competitive disadvantage healthcare here in the U.S.
Great question. And I will tell you that the current model today, we have to acknowledge that it's broken. That's the first thing we all have to acknowledge. And the reason is the costs are absolutely unsustainable. So I agree with you as an employer of the 37,000 team members and their dependents, we're spending way too much on healthcare and we can't afford that. So what I'm starting to do though is truly tear down the old delivery model of healthcare. And I'm going to give you an example. I gathered 50 nurses across the Novant Health footprint to redesign the delivery model at the bedside, to get them at the bedside with patients, to spend more time, practice at the top of their license, and more importantly, truly be in the room on direct patient care. And I asked for about a 30% improvement in efficiency. Those nurses developed a new team approach, launched it throughout Novant Health, 55 med-surg units, and I'm proud to tell you they're today practicing at the top of their license. They went from 40% of their 12-hour shift on direct patient care to now 76%.
Right.
And they saved Novant Health over $55 million in a given year. It's that kind of transformation that we have to go through everywhere throughout our healthcare system, front office, back office, to truly then be able to provide the quality care at a more affordable price.
But do you get, I'm sorry, Jeff, but let me just follow quick. Do you get a skeptical eye from your own team members to say, you know, I like what you're doing, you're empowering us, but there's got to be a catch. How can we step out, and how are we going to do this and stick our heads up out of the foxhole and not get it shot off first, kind of stuff?
Well, I think it's a good point. In fact, I round a lot at our facilities, and when I first talked about doing this, having nurses practice at the top of their license, again, I want 70% of 12-hour shift on direct patient care, and I want a 30% improvement in efficiency. One of our 20-year nurses looked at me and said she was horrified, because typically someone would have told her how many more patients to see. I was rounding just recently, and that same nurse stopped to tell me she couldn't wait to get to work in the morning, because for the first time, she had designed a model that put her in the room with patients, spending more time on the care that they deserve. Yeah. And let me tell you what it's done for patients. This is where I think our providers get excited. It's absolutely reduced patient falls. It's reduced medication errors, because we've gotten nurses away from the hunting and gathering and all the documentation and more focused on the direct patient care.
Mm-hmm. Jeff?
Yeah, Carl, I want to switch gears. We talked a little bit about the impact of the decisions around Medicaid expansion and the impact on rural communities, small towns. One of the things we've noticed at the Institute in looking at the post-recession recovery is that it's a recovery primarily in the urban areas.
Right.
Raleigh's doing great, Charlotte's doing great, Charleston, Greenville, but many of our small towns really still are struggling. And in fact, since 2010, nearly half of North Carolina's counties have actually lost population, according to the U.S. Census. In the field of healthcare and provision of healthcare in these communities, what impact are you seeing those same struggles having in your field?
Well, Jeff, I would tell you that I think I'm very concerned about the small community hospitals, particularly our rural hospitals. Mm-hmm. In fact, at Novant Health, we started trying to find new ways to partner with these hospitals because of the reimbursement cuts, because of their inability to attract certain specialties and keep their programs open to the public. So we actually started a company called Shared Services, where we're providing a lot of our back office capabilities, trying to create synergies for them. And today, there's probably a number of those rural hospitals, community hospitals, that we are actually their bottom line. These shared services value that we provide is actually keeping them in business. So I'm really concerned about the long-term health of those community hospitals, particularly the small ones and particularly in the rural areas, because we're seeing their population shrink, we're seeing their overall market shrink for healthcare, and so it's hard to sustain organizations in those parts of the market.
It also places a greater responsibility on the healthcare sector in terms of being one of the largest employers in many of these communities as manufacturing has declined.
Absolutely. And keep in mind, it also puts a large stress on large organizations like Novant Health. Because when you think about it over time, you can't save everyone.
Yeah.
And there's not enough resources to figure that out. So, I mean, I think we've got to come together. We've got to find a way to get Medicaid expansion. We've got to do it in an economical, prudent way. But again, and I can understand the argument of budget certainty and Medicaid reform, but that's what providers are to step up and start to try to help with solutions as to how we actually get the Medicaid expansion that we need.
Dick?
You know, one of the things that we're working on with the Greenville Health System is this transition from fee-for-service basis to population management, which from a company standpoint is very, very attractive because you can emphasize health, not exactly all treating conditions.
Right.
You mentioned that you're doing things with your own employees. How are you transitioning to population management with the employees of Novant?
So part of it is when I talk about taking all of the hospital-centric resources and reallocating it into these geographic communities or these patient-oriented delivery models, it's beginning to proactively intervene and risk stratify where is the disease state, how aggressive do we really need to be, and I'm trying to intercept patients from just showing up in the emergency room. Mm-hmm. So part of what we're doing early in this process is we uncovered that we've got a number of our own employees that don't have a primary care physician. Mm-hmm. So again, we've got to get people to the right place at the right the right price at the right cost. And so, end of the day, I would tell you, you're going to see Novant Health be much more proactive in how we get at preventive services, how we get at truly getting patients early in the process versus waiting till folks are sick. Part of what I'm proud about too is we're introducing new price points. So with our electronic health record, we're introducing, for example, e-visits, video visits. We're introducing web-based scheduling, what we have at all of our primary care sites. So we're really making it convenient for people to access these new price points. In addition to that, our health system has converted a lot of the hospital-based imaging to freestanding. Again, new price points. We're opening up convenient care clinics, extended hour clinics in primary care with new price points. So I think what you're going to see is this opening up of access, these new price points should invite individuals into the healthcare system in the right place, again, at the right price.
Let me put you on the spot, though, and say that a lot of what we saw at Michelin that drives healthcare costs is choices that individuals make, employees make.
And you know what, I wish I could, but we've got less than a minute,
okay.
So state it just very quickly and give Carl a chance.
What are you doing to get your employees to stay healthy?
So, again, I can tell you just some quick examples of what we're doing just with meetings. We're starting to eliminate the cookies. I mean, you got to get at. I mean, first of all, you've got to get people focused. The other thing that we're doing is we're requiring people to truly work on exercise. We're trying to get the smoking out of the system completely. I mean, so my point is, we've got to get serious and be aggressive with some of the things that we hadn't wanted to talk about in healthcare, particularly when it comes to keeping people healthy.
Right. Cookies and smoking. I like that strategy. In about literally 30 seconds, Cone Healthcare broke cover. They're going to do health insurance now. They're going to be a supplier of health insurance. Is that a growth area for hospitals? Would you do that? In 20 seconds.
20 seconds. I tell you what, Novant Health is looking at all options. I think what we have to be prepared for as a health system, we want to partner with other managed care organizations to truly find a way to get paid for the value that we're going to drive, particularly with quality outcomes. But if managed care companies can't partner with us, we're going to have to find our own mechanism for doing that.
Last word, come back and talk about it. Thank you, Carl. Good to see you. Gentlemen, thank you for being on the program.
Thank you.
Enjoyed it.
Until next week.
Thanks, Carl.
Good night.
Thank you.
Bye.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.